What is MR-TRUS fusion biopsy?
MR-TRUS fusion biopsy is where we fuse the images of MRI with the images of ultrasound, and we use these data for better localize the potential tumors within the prostate.
Why is it required, and how different it is than traditional prostate biopsy?
It's a great question. For many decades, we are using templates when we perform prostate biopsy. So we know where the prostate cancer usually develop within the prostate. But what we do with the conventional, the standard prostate biopsy, we just take biopsies from those areas where the probability of the prostate cancer location is high. But with the MRI technology, now we are able to localize specifically these suspicious tumoral tissues within the prostate, and then we can target these lesions with the aid of this fusion technology.
How is a TRUS biopsy performed?
There are two potential ways. One is with using a transrectal approach, where we take out these biopsies through the intestine, this end of the intestine, and the other approach is the transperineal approach, where we do not have to get into the rectum. We can take these biopsies through this perineal approach, where the potential of the infection because of this ficus is decreased.
Is the procedure painful, including the post-op period?
Okay. Our approach is performing this biopsy under local, not under local anesthesia, under anesthesia, and it's usually a sedation combined with analgesia. So patients do not experience any negative things during the biopsy, since they are sedated. In the postoperative period, we also modify our medicaments so the patients do not have any kind of complications regarding the pain in the postoperative period.
How long does a fusion prostate biopsy take, and when does the result come out?
In our center, the procedure is within 20 to 30 minutes, so it's a quick approach. And after the biopsy, patients usually discharge within the next 4 hours. And we are really lucky to have such a pathology department where we get the results of this biopsy within the next 24 or 48 hours.
For which patient cases do you usually recommend MR-TRUS? Is it a standard practice now in modern urology?
Yes, it's a standard practice. So every patient in whom we think that there is a potential prostate cancer, we perform MRI image. And with the results of this prostate MRI image, if there are suspicious lesions, then we perform our biopsy with MR-TRUS fusion biopsy.
Thank you.